Hi, good morning, Liam. My name is Alicia Barrett. I'm your invigilator for the OET speaking session conducting on the 15th of January 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you say your full name for the record, please?
My full name is Liam Hughes.
And what is your candidate number, please?
My candidate number is 203207532.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Which role will you choose in your career?
I am someone who loves the process of teaching and learning. I have always settled myself in any surrounding that involves delivering skills from one person to another. The clinical nurse educator's role serves humanity and helps them not get scared of the hospitals. The flexible and stimulating work environment has also made me enter this field of teaching and learning.
What are the roles of a clinical nurse educator?
The clinical nurse educator, also known as the nursing professional development specialist, is responsible for giving various training and other development duties in the healthcare facility. Most of their work is focused on making sure that the nurses have the right training and skills to get better in their units. They are responsible for designing the curricula, teaching students, advising students, evaluating them, promoting discussion in students, and overseeing students' clinical practice.
What are the qualities that a clinical nurse educator should possess to be effective?
Being in the role of a clinical nurse educator, one has to possess certain qualities that help him or her serve the organization better. One must be appropriately educated, have teaching skills, can work along the rest, possess the expertise, assessment skills, love for nursing, and have strong communicational skills.
What major challenges did you face during your last role? How did you handle it?
As a clinical nurse educator, I had to go through several phases and moments that challenged my abilities. I had to be extra careful and cautious about many things during that phase. The few significant pain challenges were the long working hours, workplace violence, personal health, and staff shortages. These were a few things I battled with, but over time, these challenges made me highly skilled. I gained experience and became a better clinical nurse educator.
Describe your daily routine as a clinical nurse educator.
My daily routine in my previous role included the teaching part majorly. I had to cover the course content, course syllabi, teaching strategies, and evaluation methods. Then I had to carry on meetings and do committee work. The scholarly activities also included publications, writing for publications, and teaching. Student advisement was also my responsibility.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients or perhaps a relative and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi, good morning. My name is Liam Hughes, one of the registered nurses in this community health center. May I know your name for the record, please?
Good morning, nurse. My name is Alicia Barrett.
Hi, Alicia. May I know what brings you here today?
Nurse, I am very much concerned about the varicose veins on my left leg, which have become increasingly itchy.
Don't worry, Alicia. We are here to help you. Let me examine your leg, please.
Sure. You may please.
Thank you. Well, from my examination, I could see the inflammation of varicose veins. May I know about your health in general, please?
I am healthy. I do not have any other health concerns.
Good to hear that. Well, Alicia, for better understanding, I would like to collect a few details from you. May I proceed?
Sure, you may please proceed.
Thank you for your consent. First, I would like to know a few details about the symptoms shown. How long have you been feeling the itching?
The itching started a few months ago. However, in the last couple of weeks, some of the veins have become much itchier.
Okay. Can you please tell me how severe it is?
At the beginning, it was not so severe. But in the last couple of weeks it became so vigorous and unbearable.
All right. Have you ever noticed issues like swelling, the feeling of heat, or any other issue?
Yes, I do notice some. When I scratch, my skin is becoming red and there are scabs forming as well. I found my veins are just a bit swollen. Perhaps they don't feel hot.
Okay, thank you for the information. From my assessment and your words, it might be a condition called venous stasis dermatitis, which is the reason for itchiness. Well, I will explain it to you for better understanding. It is a chronic inflammatory skin disease. In this condition, the blood gets built up in damaged vessels, and eventual leakage or oozing of blood into the skin. Is it clear to you, Alicia?
Yes, nurse. I understand that.
All right. May I know, have you tried any remedies for your condition? For example, applying any medicated creams or moisturizer or something like that?
Well, I haven't used any medicated creams. However, I occasionally used moisturizers, but they didn't seem to help.
Okay. Applying moisturizer only while feeling itching may not work. I will provide some recommendations to ease itchiness. Apply moisturizer, or use a thick emollient, without fragrance or dye, on the area of itching, at least twice a day. You can also try using compression stockings. These will help you get rid of itching to a greater extent.
Thank you, nurse. I will try these recommendations.
Great to hear that. One thing to emphasize is that it is very important not to scratch. Scratching may worsen itching. It may also lead to cuts and further lead to infection.
It's very hard to stop scratching. Nurse, I am not doing it intentionally. I'm scratching as they're very itchy.
I understand your situation, Alicia. Follow my recommendations and it will reduce itching. If the symptoms get worse, schedule a doctor's appointment and consult without any failure.
Sure, nurse. I will take care of it.
Alicia, I would also like to remind you about the management and self-care of the varicose vein. Try to keep yourself active. Always use loose clothing. Avoid standing or sitting for long periods. Make it a habit of keeping legs elevated when sitting.
Sure, thank you for your suggestions. I will follow your instructions, nurse.
Your words make me feel content. I wish you a speedy recovery.
Thank you, nurse.
You are very welcome.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.